Hi everybody, I'm Dr. Max. It's usually at Hair by Dr. Max Restoration Center in Fort Lauderdale, Florida. I'm here with Ross. Thank you so much for coming back.
No
He's
problem.
here for his follow-up visit. It's exactly 15, almost exactly 15 months since his procedure. He had a combination of robotic, ARTAS robotic, and manual extraction. We did it in May of 2023, 2,600 grafts in total. He's about to get his follow-up PRP treatment. He just finished hyperbaric chamber therapy, right?
Correct.
How was it, by the way?
Fantastic.
All right, you feel all pumped, right? A lot of oxygen flowing.
The oxygen is working everywhere.
It would be great to share your experience with the procedure and the recovery and so on.
Yeah, first of all, I run commercial at Venus, and we actually have the robot and NeoGraft. So we have an automated FUE device and then the robotic FUE device. And we have a lot of wonderful hair restoration surgeons, but I had a little bit of a preference for Max based on his length of experience, and most importantly, his hands-on, not only from the robot to the harvesting, to the site making, to the implantation, to his artistic touch of drawing the hairline so it's asymmetrical, so people don't look at you strange and know that you had a procedure. I couldn't be more pleased, as you can see from my haircut, that I keep it pretty shaved on the sides. And considering I had 800 grafts from here, 800 grafts from here, and 1,000 from the back, my only concern of having the procedure was, could I continue to wear the hair the way I like to wear it? And of course, as you can see, when you slick it back, you really can't see the volume or density as much as when it's dry. But I can tell you that, I've worn it this way for 30 years when I had a lot more hair, and I can wear it like I did when I was in my 20s.
Perfect.
The complete experience here from not only you, your staff, pre-op care, the post-op care. There's very few centers that have taken it to that level of sophistication, precision, as well as bedside care. So I knew this going in. I certainly did my research, but I'm very appreciative of the staff and everybody here and the result that I got.
What you were concerned about, if the punches can leave some scars.
Yes.
And in fact, it's almost undetectable at this point, right?
Nobody. So, it's impossible. No,
with
nobody.
Your sides and back is completely shaved. You cannot see not the robotic extraction, not the manual extraction. It looks natural. And even if I didn't know that I did your procedure and I see you in the street, I will never guess you had a surgery done.
Right.
Because the absence of scars or linear scars, even dots here, and a nice natural hairline. I wanted to make sure, we're not going too low with the hairline and it's age appropriate.
100%. You kept the hairline very close. You squared it off a little bit. But once again, that's the art side. The science side is the devices and how well they harvest and site make and implant.
Absolutely.
Yeah.
And with the robot, I can attest that the robot produces one of the most quality grafts, okay? What determines the survivability of grafts is the presence of this adipose tissue around the bulb and the bulge areas. And when you compare grafts extracted by ARTAS, they are chunkier, okay? So what that means, they do better.
One of the things that you do that also impressed me were these grafts were treated better than children. They're on a table that is chilled.
Yes.
That, also, so from a survival rate, not only does the robot keep the right amount of adipose tissue around that bulb, but the care that you take of when you extract them, put them in PRP, and then take them back to the microscope. I don't think anyone in the country is doing that.
It's all these details are important. That's what determines whether we have a good survival or a bad survival rate. And that we try to incorporate every single knowledge or, based on our experience. And we definitely, I think we got pretty successful in your case too, right?
I'm very pleased. And as they always say, you are who you attract. So if I'm a perfectionist, he's a perfectionist, and that's the way he approached the hair restoration.
All right. Thank you so much.
Thank you.